I think Vishal, we need to start now.
Yeah, sure. So let's start the session now. Good evening, everyone. My name is Vishal Sinha. I welcome all of you to the webinar on career opportunities in healthcare. First of all, I would like to introduce myself. I'm Vishal Sinha. I've been with Apollo Hospitals Group for the last 15 years. I'm heading sales and marketing for the vertical, which is Apollo MedSkills Limited. Today, I have with me Dr. Srinivas Rao, who's the CEO of Apollo MedSkills, and he is the expert speaker today. Dr. Srinivas is a medical doctor by profession, and he also carries a degree in management from ISB Hyderabad and is also postgraduate in medicine. He has done his MRCP. So today he will be the guest speaker and he'll address all the queries which has been received at our end from various speakers, from various scholars across the country. So Dr. Srinivas, I would like to hand it over to you to give a brief intro of yourself and then we'll commence the session immediately. Thank you.
Hi, thank you, Vishal. And first of all, I would like to thank each one of you to take time on this weekend and join this information session. And the next 30 to 40 minutes is going to be definitely a great source of information for you. So my name is Dr. Srinivas Rao. I'm a physician internal medicine consultant by education. And I've also did my management graduation from Indian School of Business. So worked in healthcare industry for last over 25 years of experience now. So worked for Apollo Hospitals, GE Healthcare, Siemens Healthcare, worked for Medvarsity and Apollo MedSkills, to name a few of the companies where I have worked for. So I have experience spanned across hospitals, health insurance, medical tourism, medical education industry. So keeping this short introduction, I would now ask Vishal to take over and continue his moderation. And thanks again for taking out your time today. You're on mute, Vishal.
Yeah, I'm so sorry. So yeah, thanks a lot, Dr. Srinivas. So the webinar will be like first 30 to 40 minutes, as Dr. Srinivas mentioned. We'll be covering the questions which have been received at our end. These questions relate to all the areas related to healthcare sector. And then after that, we'll have a Q&A session wherein the participants can unmute and they can ask these questions to our expert speaker. So Dr. Srinivas, I've collated the queries which have been asked by hundreds of callers. So the first query which I would like to put it to you is like, what is the current scenario of healthcare sector in the country as of now, and especially after COVID? Thank you.
Thanks, Vishal. I think very pertinent question to start with. So definitely the global pandemic has made us to take notice of the healthcare industry like never before. So everyone's attention has come to healthcare like never before now. From doctors to medical practitioners to frontline health workers. So the whole healthcare industry now stands at the core of our well-being, and it's quite recognized. So as you know, healthcare industry in India, it comprises of hospitals, medical device companies, clinical trials, telemedicine, medical tourism. It's a very vast industry, and it's growing at a very tremendous pace, owing to its strengthening coverage. And just to give you a perspective of each of these industries, the hospital industries in India accounts for 80% of the total healthcare market. Today, the curative market, which is the hospitals, covers 80% of the total healthcare market, both in terms of revenue and also in terms of employment in healthcare. So, and it is witnessing a huge investor demand from both global as well as domestic investors. If you have seen in the last 1 decade, there are a lot of international investors who have been investing in Indian hospitals. So definitely there is a global attention towards Indian healthcare industry. And the hospital industry alone is expected to reach about 61.8 billion. So it is now at 61.8 billion and it's expected to reach to 132 billion by 2025, not very far. And similarly, the medical tourism industry is also around 10 billion and expected to reach to 13 billion in the next couple of years. And the diagnostic industry has boomed, and which is currently valued at about 4 billion, and it is growing at a whopping percentage of 50% growth year on year. And every year there are another 40% new labs being added. The primary healthcare industry, which includes the rural healthcare, in that there are about 156,000, that is 156,000 Ayushman Bharat centers opened, which with an aim of providing primary healthcare services to the Indian citizens. And the market of Ayush, which is very impressive, it's not just the allopathic medical market that's growing, it is also the holistic medicine, Ayurveda, Unani, Siddha, and homeopathy. It's also growing at 25% pace. So the growth in the last 5 years, particularly post-COVID, has been tremendous in Ayush space. And that is also expected to reach close to 30 billion by year 2025. The health insurance market is growing, and the digital health market, the number of records, the medical records that are getting digitalized are also growing. Just to give more perspective on technology, the smartwatches checking vitals to highlight a potential medical condition. So someone's heart rate is high, someone's oxygen saturation is low. The smartwatches, I think the adoption of smartwatches has improved significantly. I'm sure most of the callers here are wearing an Fitbit, Apple Watch, or multiple domestic variants of smartwatches. Similarly, the patients are consulting now doctors over video calls or mobile phone. And the biggest achievement is to vaccinate more than 2 billion people during the global pandemic. I think it's a globally big achievement for India particularly, because everyone had doubts on whether we can vaccinate everyone. I think that's another big achievement. And now the public health experts believe that India's healthcare system must strike a balance between both top-notch treatment that's happening in the private hospitals and the urban hospitals, and also to improve access to the rural masses by giving suitable medical facilities. So we are at this crossroad where both the urban healthcare and the rural healthcare have gained the priority with an equal attention. And even the private sector and the private investors are looking to invest in rural market, which is a good sign. So I took some time to answer this question, Vishal, but I think the market is quite promising, healthcare as a market today. And we look forward to a promising future in this industry now.
Yeah, thanks a lot, Dr. Srinivas. So what we assume is, what we believe is, like, the investment in the sector is going to increase manifold. It is already increasing, in fact, after COVID, if I'm right. If you look at the number of new hospitals, new diagnostic chains, and other areas coming up in the last 3 to 4 years, I think that has accelerated quite a lot. So I agree with you in terms of the size of the sector. The next question is, like, what are the verticals, Dr. Srinivas, or the sub-verticals which come under this sector? I mean, we know that hospitals is definitely the main domain, but besides hospitals, what are the other verticals within the sector?
So healthcare as a term is a very broad term. So as I told in my initial answer, I think healthcare is has been traditionally synonymously used for hospitals, but it's a very larger term covering hospitals, health insurance industry, medical tourism, digital health, medical coding. Possibly, I think I will just showcase a slide that could help everyone to understand what I am saying. Is everyone able to see my screen now? The slide on my screen?
Yes, Dr. Srinivas.
This is what the healthcare industry is. So I have just put it across 3 streams. Pre-episode, that means someone who is not ill, who is actually healthy. So they fall under pre-episode category. Episode, someone who is ill. So someone has an episode of illness. And post-episode, which is after illness or after discharge from the hospital. So in the pre-episode, which is a preventive space, I call it as proactive, because people want to take care of their wellness or fitness. So a lot of fitness industry that is growing up now. I think one of the fitness startup, Cult Fit, is becoming unicorn. So that means a lot of people are actually taking up wellness and fitness as their top priority. Second, preventive healthcare checks, the diagnostic checks, someone who wants to check their cardiac profiles, lipid profiles, who want to check their liver function tests, I think this market is really growing fast, and this is also one of the fastest growing industries now, diagnostics within healthcare. Home care is emerging, so people want the healthcare industry to come to their home to take like sample collection from home. That's what applies to diagnostic industry, and a lot of telemonitoring, smartwatches and everything to look at number of steps that are walked each day, to the pulse rate and heart rate and blood pressure getting monitored from their smartwatches. So this is a proactive approach. Reactive is something after you fall sick. It has been traditionally the mainstay. As I told you, 80% of today's healthcare is in this space. Hospitals, clinics, urgent care, emergency departments, similarly telehealth consultations and mobile health platforms. Someone get discharged, as I told you. So someone getting a post-operative care at home, to rehabilitation after a knee surgery or a hip replacement surgery, doing physiotherapy after a stroke. So diagnostics after discharge from hospital, tele-monitoring after discharge, and hospice care, which is an end-of-life care in cancers. So this is what the healthcare is. But apart from this, you also have large industries. When I say large industries, industries like health insurance, digital health, they all are medical tourism, all are part of the healthcare industry. So that's how you differentiate a hospital and healthcare industries, and that's how you differentiate a hospital management course and a healthcare management program, because healthcare management program covers much more wider spectrum of healthcare elements in the program.
Thanks, Dr. Srinivas. That's quite informative. So in terms of, since the topic is about career opportunities, so what are the typical hierarchies, or what is the organogram in a professional healthcare setup, be it a hospital or any other one?
Okay. So again, I want to take a slide share here. Are you able to see my screen?
Yes, we are.
Yes. So if you see healthcare as an industry, just this is for most of the students who have joined are from the non-healthcare background here on this webinar today. So if you see healthcare as an industry, if I put it in a pyramid form based on the volumes of resources, on the top of the pyramid, you have the super specialist doctors who are cardiac surgeons, plastic surgeons, neurosurgeons, who are at highest level of education in medicine. So they form the top of the hierarchy of the healthcare resources. Then you have MD and MS who are specialist doctors. These are MD internal medicine, MD ENT, MS ophthalmology, MS ENT, then gynecologists and obstetricians, pediatricians, orthopedicians. There are about 14 specialties in MD/MS. They form the next layer of pyramid in healthcare resources or hierarchy. Then you have MBBS doctors who are graduate doctors and who intend to do primary care services. So they become family doctors, or they provide primary healthcare facilities in the rural areas. They work in primary health centers. Then you have nurses who are kind of backbone of the healthcare industry. We know most of the delivery in the hospitals happens through them, and nursing has become one of the very lucrative careers these days and have highest demand globally now. Then we have healthcare management and operational resources who are extremely critical, because hospitals are under tremendous pressure of process improvement, are under tremendous pressure of turnaround times. So the healthcare management as an education, as a subspecialty, was very, very limited until last 5-6 years back. We are one of the first pioneers in giving the healthcare management education. I think Apollo is the second institute in India after AIIMS. AIIMS started its first healthcare management program in 1961, and Apollo has started its first healthcare management program in 1986. So I know the second competitor in this space came after 20 years to AIIMS, but this is the first healthcare management program. And healthcare management programs, healthcare management resources are in huge demand, because there are no more number of beds added. Every year there are 100,000 beds. That means 1 lakh beds being added in public and private sectors. And for every 10 beds, you need a healthcare or a hospital management resource. This is only for the hospital industry. but the IT industry is looking for healthcare management professionals who can join them as business analysts and so on. So that's another large area, which is quite nascent in India, I would say, and has a huge potential. Then you have allied health and paramedical resources. These are lab technicians, dialysis technicians. Then you have blood bank technicians, operation theater technicians. There are close to 46 roles in allied health, paramedical, and support service area. Support service area is a newly emerging area at the bottom of the pyramid. These are geriatric aides who take care of senior citizens at care homes. These are also phlebotomy technicians who collect samples from your home. These are housekeeping staff in the hospitals. These are security staff in the hospital, and multiple such resources. So this is the hierarchy in the healthcare today, specific to the hospitals. Thanks, Vishal. Yeah.
Yeah, thanks, Dr. Srinivas. That was very informative, and it's interesting to note that healthcare is such a manpower intensive sector. And the next question is, what role do healthcare administrators and managers play in the whole gamut of the sector? What is their importance compared to the clinicians?
No, you see healthcare as a sector. So when you say clinicians, most of the time it is used in a sense of doctors and nurses, but healthcare is very human resource intensive. So if you see many sectors getting digitalized, right? There are a lot of digitalization happening in banking. So we rarely go to banks physically to draw money. We go, these days people stop going to grocery stores also because there's Big Basket, there is Blinkit, multiple apps delivering at home. Food is delivered at home, Swiggy, Zomato. Then a car comes to your home to pick you up, Ola, Uber. So there's a revolution happening everywhere, but healthcare seems to be slightly lax in adopting. I would say it is not lax, but it is selectively adopting technology. Okay, so when it comes to roles, as I told you, only doctors and nurses, but there's a tremendous role played by pharmacists, by the technicians, by the physiotherapists. So these all are interconnected healthcare professionals and interdependent healthcare professionals. The beauty of the healthcare management is all these professionals, including the engineers, when they come together, I think that's what healthcare management education does. So I just want to again showcase a small slide because I have young students on this webinar and most of them would love to see the pictures. So that's the reason I've just collated some slides. Let me just share the screen again. Yeah. Yeah, I think this slide. So healthcare as an industry has 5 pillars. 5 pillars of delivery. So if you go to a hospital, there are 5 cycles on which the healthcare industry works. The first is the administrative cycles. So when you go to a hospital, you will find a security guard saluting you or greeting you. So security is one administrative service. Then you have a front office management, which is an administrative department in the hospital. Then you have human resource department, HR department. You have the payroll in the organization. You have supply chain management, which is purchase and procurement in the hospital. Marketing, these all are the administrative cycles in the hospital. So you don't need doctors or nurses to run these, and you need a large manpower who come from the hospital management background to run these administrative cycles. Strong hospital management knowledge is required to run these cycles. I would say that the difference between a great hospital and a good hospital now is the strength of the administrative and technological cycles and quality cycles, which were not that prominent in the past decade. The second cycle, the second pillar on which the hospital runs is the clinical cycles. When I say clinical cycles, you have emergency rooms, you have intensive care units in the hospital, you have outpatient departments, you have inpatient departments, you have pharmacies, you have nursing departments. These all form clinical cycles in the hospital. So the clinical pillars are super critical for care of patients, for healing the patients. So this department is not the core of healthcare management, but they are complementary to healthcare management. The third area is financial area. So the pricing department, the pricing of packages, then you have the billing in the hospital. Then you have the health insurance department, which has account receivables and payables. So these all are financial cycles in the hospital. The fourth area is quality. Now, healthcare is a service industry, and quality becomes extremely critical for you to kind of grow or drive this industry. And you have well-established quality standards now. Domestically, we have National Accreditation Board of Hospitals, NABH, and National Accreditation Board of Labs for laboratories. You also have international quality standards in India, which is JCI, which is widely followed, Joint Commission International. You also have quality standards like Six Sigma, ISO, all part of healthcare now. Finally, the technological cycles. The technological cycles of the hospital information systems in the hospital, the medical devices in the hospital, the biomedical engineering departments in the hospital, the biotechnology devices. So there are multiple scope. Now the telemedicine through which the remote consults are happening, the electronic medical records, the electronic health records, more importantly, the application of artificial intelligence on the data, electronic data that is collated. These all are part of technological cycles. One point before I end that I want to impress upon this slide is the healthcare management as a profession is of wide scope. It is not just for doctors, nurses, pharmacists. Even a general graduate, a BCom graduate who have got a strong knowledge of finance can join in the financial cycles of the hospital. An engineer who has done his electronics or computer science can join the technological bits of hospital. Someone who has got an inclination towards quality can join the quality departments of the hospital. Someone who has got a procurement experience, someone who wants to do HR, human resources, healthcare, human resources, quite challenging and very good to be associated with. So the healthcare management as a program covers all these aspects in healthcare. So this slide, I just wanted to showcase to improve your memory of what I am talking. Thank you.
Thanks, Dr. Srinivas. That was quite an elaborate description of the entire gamut of the operative aspect of the hospitals. So the next question is, what are the kind of programs available for graduates from different backgrounds? So what is understood is like there is a huge scope for people from different backgrounds, multiple backgrounds, right? So that is the uniqueness of healthcare, unlike the common perception that healthcare is only for doctors or nurses or even paramedics. So what comes out very clearly is there is a huge opportunity for graduates from multiple sectors. So what could be the programs which could be ideal for different kind of graduates, which you can highlight about? Thank you.
Yes, I think the multiple programs in offering in healthcare for the graduates, for be it engineering, general graduates, MBAs, pharmacists, physiotherapists, doctors, nurses in this group. And I will talk about 3 programs today in interest of time, but I would love to interact with everyone in the next webinar, covering much wider aspects of it. But today I'm focusing on 3 programs. One is a diploma in hospital management that we offer along with University of Hyderabad. This is an internationally valid UGC credited program, 1-year program offered in 2 semesters of 6 months each. Very comprehensive program, and this is one of the only programs that offer international credits in India. So there are multiple IIMs, ISBs, premium institutes doing programs, but there is no program that offers UGC credits, and this is one of its kind in that way. And the beauty of this program, again, is a blended learning program. So you can continue your current education, whoever is in a final graduation, and still enroll on this program. So that gives a flexibility of learning for the students who intend to join these courses. The second advantage of this is the carry forward credits. So the University of Hyderabad being the NAC, A-star, and also the Institute of Eminence. So this is one of the 5 Institute of Eminences along with IIT, Chennai, and IIMs. So this is one of the universities which is an Institute of Eminence, and the credits are internationally valid because of that. The third thing is Apollo brings in its vast experience. So you are learning from the leaders in healthcare industry. Apollo, I don't know how many of you know, it's the largest healthcare group in the world. I'm not joking, but we have close to 18,000 beds. And we also have diversified backgrounds. We are in health insurance, we are in clinics, we are in health education, uh, be it in health, digital health, telehealth. So we have close to 84 group companies devoted to healthcare. So that makes us the largest group. So the combination, it's a culmination of the best university in India and the best industry partner in India. So this course brings a vast experience, a great certification opportunity for the students who join. This is the first program, which is Apollo MedSkills and University of Hyderabad joint program on healthcare management. It's a one-year course. I would request our student support team to share a copy of that to everyone, maybe now, if it is possible here, or if someone can share that brochure, or you can share it over email to all the students. The second program is Apollo MedSkills and UKQI, which is United Kingdom Qualifications International Certified course. This is again a one-year program. This is a diploma in healthcare management. So there's a difference between hospital management and healthcare management. So we jointly offer, UKVI and Apollo MedSkills jointly offer diploma in healthcare management. So this is also a one-year course divided into 2 semesters, which covers the entire healthcare gamut. The third program is a short course, which is a master class in digital health. So this is a 2-day workshop that gives you insights into the digital health. When I say digital health, it includes introduction to digital health, the artificial intelligence in health, in healthcare. It covers data science in healthcare. It covers topics like electronic medical records and electronic health records, hospital information systems, and so on. It's a very vast, and also the regulatories governing the digital health in India. These are DICOM, Digital Imaging and Communication Medicine, HL7, and so on. It's a very well curated 2-day workshop benefiting the students on how digitalization is transforming healthcare. And we're also coming up with 2 major programs. One is a master's in public health and also a master's in health informatics shortly with some international collaborations. We will let you know once these programs get launched. But broadly, these are the 3 programs. One is diploma in hospital management, jointly offered with University of Hyderabad. Most of Hyderabadis know it as a central university, and we are the only healthcare industry partner for them today. It takes a great pride to say that, because there's a lot of audit mechanisms that they do before they associate with any of the institutions. The second is with UKVI, United Kingdom Qualification Institute, UKQI, sorry, and Apollo MedSkills offer a diploma in healthcare management. This is a one-year program again. And the third one is masterclass in digital health, which is a 2-day workshop, which we do over a weekend. The dates and the details of the program will also be shared with you. I think, I don't know if it is, yes, I think some of our colleagues have shared these documents over the chat. So you can see that, open the chat engine and see those collaterals, flyers. Yes, Vishal.
Yeah, Dr. Chima, thanks a lot. The next query is like most of the participants are wanting to know what are the career opportunities after doing this program, especially the management programs, and of course the digital health program. What are the kind of job options in the sector?
Okay. So the job options are multiple. In fact, it depends on the background in which their current education is. Okay, sometimes, yes, it not wholly depends on that also. Sometimes based on interest, you can change your careers as well. So if you are a fresher, based on the level of your career now, if you're a fresher, you join as an operations executive in various departments, be it front office, be it in outpatient departments, emergency rooms, dialysis. You join in health insurance sector, medical device sector. If you come with a clinical background and a healthcare management degree, then you can join hospitals, you can join medical device companies as subject matter expert or business analyst. You can join health insurance industry as networking executive or a claims executive. And then the growth is tremendous. The journey, though you begin humble journey in healthcare, When I say humble journey, maybe your start salaries may be low, maybe 25,000, 30,000, unlike IT industry. But the growth, the journey of the career is going to be tremendous. So I don't want to give a false promise that you will start at a 50,000, 1 lakh jobs. Yes, it is possible if you are experienced and you already have some experience in healthcare industry, then you can add this degree and grow in your career ladder. But if you're a fresher, you'll make a humble beginning, but the growth is going to be tremendous. I myself have started my career at, I think a decade back, it was about 4,000 rupees, but now I think I've grown 1,000 times. Needless to say about the salary, but it has grown 1,000 times. You can understand the journey over 20 years. So now you will not start at that meager salary, but now based on the inflation, now I think the start salaries here are for freshers 25 to 30,000 and sky is the limit.
Right, thanks a lot. And the next question is like, what does blended learning mean? Because these courses are in blended learning format. So what does it mean and what does it broadly cover and how can the students get benefited? Is it full-time or part-time or on weekends? What is the model?
Yes, Vishal, what this program, because most of our students are either working professionals or the students who are passing out of colleges or someone who's actually preparing for other exams and want to parallelly do a program, a diploma, which is valid and coming from the best in industry. So what we have well thought through. So our programs, all our programs have kind of 3 layers of learning. One is a synchronous learning. That means all our programs have live sessions. So from the industry experts, we invite speakers, the best leaders from the healthcare industry, be it from Apollo, Max, from AIIMS, from CMC, JIPMER, and the leading institutes across India. So when we talk about, for example, when we talk about medical legal aspects in healthcare, we invite the best medical legal experts. Possibly we'll invite them from NALSER, which is National Academy of Law, and someone who's a clinician and who has done a law degree and seen a lot of such cases. For example, we had a session on surrogate motherhood. So how the cases are being solved now, what's the complexity of these cases. So you get an expert to speak that topic. Similarly, if you are training on healthcare quality, you get the JCI members like Gaurav, Laurie, or someone coming and speaking about healthcare quality. We have speakers like Dr. Hari Prasad, who is the president of the group, coming and speaking about healthcare operations. So we have the best in the lot to come and speak. This is the first one, which is synchronous. We ensure that the best in the industry come and interact with our students. The second layer is asynchronous learning, where we have recorded sessions and we have some curated content, which is self-learning component. The third layer is a practical exposure. So for students, which we keep as optional, for students who want to get some internship in the areas of their interest, in one of these Apollo hospitals are around 800 network hospitals that we have. We provide an internship opportunities to the students who wish to go and spend time in the hospital. So someone joining this course has a triple advantage of interacting with the industry leaders, having the flexibility of self-learning, and also having an internship integrated into this program. I know most of the students studying in the colleges are struggling to get internships. This could be an opportunity to enroll on this program and get into an internship.
Thanks, Dr. Srinivas. So before we open the session for Q&A, one last question. What is the value which a university like Hyderabad Central University brings to the course in both the management courses?
Absolutely. So there's only one course that we do, and we also do a critical care nursing. I saw Dr. Mayuri or someone asking about this program, but I would ask everyone, all the students, if you have any questions in mind, please go to the chat engine and start typing as you listen to me. Okay, that will save a lot of time. Yes, what does University of Hyderabad bring? First of all, in India, most of this education is regulated, right? So when I say regulated, people want to have a certificate that they feel is credible. Okay, so one, there is a dual strong credibility to this education. One is the industry leader, Apollo MedSkills, certifying the students. Second is the university leader, University of Hyderabad, certifying. That's the first advantage. Second, this program comes with the credit frameworks, the new UGC credit framework is followed in this program. So last year we have changed because of the new education policy. There are some changes that are suggested by University Grants Commission. This course is customized to that. So we have a modular approach to our courses. And this modular approach is again given by the University of Hyderabad. The third advantage is the teachers who teach MBA in healthcare and hospital administration in University of Hyderabad are part and parcel of teaching delivery of this program. So we get faculty also from these institutes. Fourth, they have an international certificate validation cell. Suppose after your programs, you want to go to Canada, UK, US or Africa or any part of the world and go and settle, then you have an international certification validation team in University of Hyderabad distance education cell. So you have to write to that cell and they will validate your certificate and send it to your either international university or to your workplace. So multiple advantages. I named some of the few that came on top of my mind because this question also came as a bouncer.
Thanks a lot.
Yeah.
So I would like to open the session for Q&A and I would like to request our IT team to enable the same. So anyone who's having any question, please unmute their phone and they can put their question.
You can raise your hand so that
and they can raise their hand because I'm not seeing any questions being typed in the chat box. So
how to raise your hand is go to the reaction. I know I'm teaching the experts in IT, all the young generation, but you go to the reactions button at the bottom, you will find recognize hand gesture. You have a raise hand one. Yes, I think Mayuri Nargunkar, if you want to unmute yourself and speak.
Hi, sir. Very good evening.
Good evening, Mayuri.
Yes, so I am pursuing this critical care course.
Okay.
I mean, my results are awaited still. I mean, I had enrolled myself in last year's batch.
Okay.
So this Feb, I gave my exams and my results are awaited.
Okay.
Can you please throw some light on this critical care and emergency management? I mean, I being a physiotherapist, I intended to join this course because I got to know the importance of critical care management and emergency management during the COVID era because I was a part of COVID team at that time. So I eventually got interest into this management, critical management part, and then I was just searching online and through Facebook. This thing I just got to know about this course, and I had enrolled myself. So
Okay.
if I'm planning, if in future I'm planning to switch on my domain or change my domain, how far it is going to help me, sir? Because I have a vast experience of around 12 years plus in the field of physiotherapy and rehabilitation.
Excellent, Dr. Mayuri. I think
Yes.
for throwing that and thanks for saving lives during COVID, being in the front line first. Okay, so Dr. Mayuri, couple of things I would like to say. So physiotherapy and intersection of physiotherapy and critical care typically has traditionally been the respiratory therapists. Okay, someone
Okay.
has got a specialization in pulmonary rehabilitation or respiratory therapy has been mainstay in the critical care medicine, right? You also know that.
Yes.
But what happens, their role has been expanding globally now because there's a huge demand for physiotherapists and respiratory therapists post that era. So can a physiotherapist go and work in an interdisciplinary team in a critical care unit? I would say yes. Are hospitals open enough these days to do that? Not all. Only the super specialty hospitals realize this importance, and particularly the respiratory ICUs, where the physiotherapist, the pulmonologist, the nurses, the pulmonary nurse all work as an interdisciplinary team. This is one area, strong area, where you can have a scope of an employment after this program. The second area that I see is orthopedic ICUs. But again, Dr. Mayuri, I want to ask you, what's your specialization? Are you a BPT or MPT? Are you looking at any other specific areas of specialization, or are you studying currently now, apart from the critical care? Okay. Then in interest of time, I will stop here. But Dr. Mayuri, I will get back to you on this query that you have asked. Okay, you want me to unmute? Yes. One moment.
So I've done my bachelor's in physiotherapy.
Okay,
But along with that, I have been a part of emergency medicine and critical care. Not even not during the COVID period, but before that as well.
no, got it. So we
Yeah.
look, I think your career in emergency and critical care will depend on your further course of education. You are taking this, so I think your employment will be more. I would suggest that you have to focus more in the pulmonary rehabilitation, cardiac rehabilitation, and the ortho rehabilitation area. These are the three areas where the ICUs hire physiotherapists. Okay, and
Yeah.
more about this we will discuss because you are part of our family. So we will connect. So I will ask our team. I have Mamta Richard from our team to on this call. So she will connect both of us over a call.
Yes, sir. Definitely.
Okay. Thanks for joining this, Mayuri. Nevertheless,
Thank you, sir.
adding some value by asking a nice question here. Thank you.
Yes, sir. Thank you.
I had seen another hand raise, but
Yeah, there's one query. If I can just put it, there's a query
yes.
from Dr. Yadagiri Rao regarding career opportunities after 10+2 for upcoming students.
Hello, yes. Dr. Yadgir Rao is a dear friend of mine. I really respect his presence here. Thank you very much, Dr. Yadgiri, for joining this call. For 10+2, yes, we have lots of opportunities for students at 10+2. So when I showed you that pyramid of education, I showed two layers, which is the support service layer and an allied health area, layer. Again, I will showcase that slide. So the bottom two layers, allied health and support service, these are the two areas where we significantly take students from 10+2 background. Here we take them on as to train them in medical lab as medical lab technicians, dialysis technicians, blood bank technicians, operation theater technicians, and so on. But nevertheless, we also have a short program called hospital operations executive and medical records technicians. So we have 2-3 programs in healthcare operations for 10+2. One of the biggest challenges that the hospitals are facing is how their front office and how their patient care attendants show empathy and smartness when the patients come to the hospital. Today, the doctors and nurses are not available 24/7, right? So you need someone who can actually show a similar empathy, similar care in their absence. So they should know some clinical knowledge and hand-holding before they take the patient to various departments. So we do specialized training called patient operations or hospital operations executive. And this is one program in operations, but otherwise there are about 14 courses that we do for 10+2 students. Dr. Yadgir Rao, thank you.
Can we have the next query? If anyone has any question, please raise your hand and ask the query.
Okay, so I would request Dheeraj to type his number, but if you have any queries and if you want further details on this program, so I'm just looking at Dheeraj's number on my phone.
Yeah, I'll just type in Dr. Srinivas. I've already typed in. And
you have
once
already
again,
typed it. So please reach out to 98857734424. No, sorry, 7, that's the number, 733114856. Please reach out to this number and Dheeraj will be very happy to address your queries. He's quite humble and sharp. Even if you don't want to join, call him once.
So there was a query related to internship opportunities, Dr. Srinivas. So I guess these opportunities are available for candidates enrolling in the management course. Am I right?
Absolutely right. So because the internship is an integrated part of our hospital management and healthcare management programs. So we also have a question from Dr. Amit Verma, who has completed D Pharma. Yes, Amit, you are eligible to join either the hospital or healthcare management programs. And after that, yes, there would be a placement support.
Anyone else has any query, please raise the hand. We just have a few minutes left. So we can probably take in 2 or maximum 3 questions.
So we
Hello.
also have some alumni who has joined us from Bangalore, a blood bank technician student from the past. We also have.
I think someone wants to ask a query.
Yes, please. Yeah.
They can just unmute and quickly ask Dr.
I
Srinivas.
think we need to unmute. Mr. Madhu wants to ask a question.
Yeah, just I seen on the query from the MBA student
Okay.
asking about how this internship is useful for them.
Yes. So the internship is useful in 2 ways. One, as a part of your current course, most of the institutes want their students to do a 4 to 6 week internship. So this can be a part of your current course journey as well. Okay, because we give an internship certificate. The second advantage is seeing how things operate. For example, your area of interest is operations management or people management. Then you get time to spend in these people intensive areas in hospitals like emergency room, to counsel the patients in the front office. Someone who is interested in the digital technologies in healthcare, you get an opportunity to see our telehealth technologies, to see our medical devices, how the data is stored in hospitals. Someone who is always wondering how medical records are stored in hospital, you get an access to go and spend time in the medical records division in the hospital. Someone who wants to understand how medical education is delivered, you can come and closely work with me, Vishal, and our team here to understand how healthcare education is delivered. So based on the area of your interest, be it medical tourism, digital health, health education, hospitals, clinics, diagnostics, we can customize an internship opportunity for you and provide you if you're part of one of our courses, either the hospital management or healthcare management programs that we offer.
So someone has just asked, actually Mayuri has asked, what is medical tourism?
Okay. Medical tourism, which is currently being renamed as medical value travel. There are 2 challenges globally today for the patients. For example, if you are in UK and you got a kind of a sprain of an ankle, you twisted your ankle and you got a sprain of an ankle. You fix an appointment with orthopedician, you get appointment after 6 to 8 weeks. Today, that's the ongoing timeline. In 6 to 8 weeks, your ankle sprain will go by the time you get an appointment with the doctor. I just gave a very simple example. But if someone has, say, acute pancreatitis, or if someone has a complex cancer, someone has got, has to get scheduled for some surgery, and they are not, if they get an appointment after 4 months, that is one. Second is the waiting time. Long waiting times globally is driving patients into the countries which give an immediate medical attention. That is one. Second is high costs. For example, the cost of an angioplasty in US is almost 8 times more than what it costs in India, or 10 times more than what it costs in UK. So these patients across the globe, they wish to travel to countries in Asia, and Thailand today is the leader in medical tourism, and India will soon take it over because we have a huge medical travel tourists coming from across Middle East, across UK and US. For example, Apollo has started world's second proton therapy in Chennai. Today, apart from US and India, no one else has got proton therapy. If someone has got a prostatic cancer and he wants to get treated, then they come to India. So you go to Apollo Proton in Chennai, you have many Americans, Britishers waiting in line to get an appointment of a doctor. I'm not joking, this is serious. So that is medical tourism. So medical tourism, when it started, it was started with a very with an intent to combine our tourism. That means someone getting a coronary artery bypass graft coming to Indraprastha Apollo in Delhi, and after discharge going to Taj Mahal and spending a day there. Okay, so but it looks very awkward now to say that someone is coming for a hip replacement surgery and going to Red Fort after that. So that's how it has been conceived. Now it's called as medical value travel because people come here both for an intent of medical treatment as well as tourism, because India has got such a rich tradition, heritage, and large number of things to see. So that's what is medical tourism. When you combine your medical treatment and the tourism activity, so India is medical tourism market is also tremendously growing, Mayuri.
Thanks, Dr. Srinivas. Any further queries from any of the participants? In fact, I have already typed in the email ID and the phone numbers for a free brochure which can be had, which can be mailed immediately. So it can be sent across to Mr. Dheeraj's mobile number. In fact, if someone wants a personalized counseling, that is also available at our Apollo Hyderabad office. Dr. Srinivas, this medical tourism is covered as part of healthcare management, am I right?
Yeah, medical tourism is a part of healthcare management and hospital management, both these programs, yes.
Yeah. Because there was a query about this course. So there's no separate course. There's no need for a separate course since it is part of.
Yes. We had possibly we will come up with a small workshop, just like the one that we are doing in digital health, a 2-day or a 3-day workshop on medical value travel and medical tourism as well. And we'll inform you, Dr. Mayuri. Yeah. So rest on the group, please ask any questions that you may have in your mind. We have another 5 minutes to go. We have started a little late, but I really appreciate the discipline of the first 13 students who have joined at, I think, almost 5:45, and rest 28 people who have joined sharp 6 o'clock, and the rest 30 people who have joined at around 6:05. Okay, so really appreciate your discipline on a webinar, because I know it's a Saturday evening, and taking out time for education and academics is a great investment of time. And I hope you all are carrying out some piece of knowledge from this webinar.
So we are just waiting for any other query else.
So our IT team is asking for you to mark your attendance on a Google form so that we can send you a certificate of attendance of this webinar. So if you go to the chat engine, just open that Google form and just fill your details, and please fill your name correctly so that it appears right on the certificate when you type it. So I'll randomly pick some names. So if you have, so Manker Rohit Kumar, if you have any questions, please ask. Muhammad Wasim, Rajni, Siddhantam, Shweta, Ambarish.
In fact, I would encourage participants to ask any questions since they
Abhay, Ritesh, Anupriya.
Yeah. Because it's not frequent that Dr. Srinivas takes out time. It's sometimes not possible for him, since he travels a lot, to take out time and to address a webinar on career opportunities. And this probably is the best time, since a lot of you are looking for new programs in the fresh academic year.
And we have also streamed this live on YouTube today. So
in fact, the queries can be on any topic related to the courses or healthcare sector as a whole as well. So Dr. Srinivas, since there are no more queries, probably we'll wait for 2 to 3 minutes and then probably end this session. You're on mute, Dr. Srinivas.
yes, Vishal, absolutely. If we can wait for a couple of minutes and then we can sign off from the session. And I really would like to thank each one of you.
Yeah, thank. There's one question from Mr. Ambarish Sahu. Whether online classes will be on a regular basis or on a weekend pattern?
Yes, for these programs, particularly, it will be a weekend pattern, Ambarish, but people who have missed those sessions can also have an access to these live sessions later on the learning management system. So you get an access to an LMS. So if you have unfortunately missed any of the session because of your schedules, you can again come back and see these sessions on our LMS. LMS stands for Learning Management System.
Right, thank you, Krishna. So it's a pretty flexible model of learning. The next question is for MBA finance people, do you follow any ERP application?
Yes, Rajni. So we teach what is ERP, okay, but we do not specifically tell which ERP on a specific ERP like an SAP or a Zoho or the prominent ERPs. We don't teach them, but we will teach. For example, I talked about hospital information system, right? Hospital information system is an interconnected system between the administrative cycles, the clinical cycles, the financial cycles, the quality and the technology cycles. So it's an interconnected SAP. So it also manages people, it manages procurement, it manages the clinical cycles, it sends reports to the patients. So it's an ERP basically. But we don't confine our learning to a specific brand of an ERP like an SAP or Zoho or anything, but we do touch upon the ERP aspects. That's a good question. I'm assuming that you're from a computer science background, maybe.
Thanks. There's a query interestingly on people dying on, dying in gyms due to heart attack. So, though
Yeah.
that's a different topic, but still, if you can address that.
Yes, that's a growing concern. Who has asked this question? I think Gajula Abhaya, right? Yes, that's a growing concern. As a physician, I can answer that. People say that it's linked to COVID or COVID vaccine. Definitely not linked to the vaccine, as the research shows. But yes, COVID may have long-term side effects because generally any research outcomes will come after 2 to 3 years. We have to wait and watch, but definitely there is a growing concern and a pattern of death of young people, particularly who had suffered from COVID. But nothing to worry. Keep your lifestyles well. Keep your fitness. Don't put on weight and eat responsibly. So, and ensure that you're walking, because I think sedentary lifestyles are very, very bad. So ensure, I wish I did this webinar while walking, but I couldn't. What I mean to say is whenever you get an opportunity, please walk and ensure that you're at least walking 7 to 8 kilometers in a day, irrespective of your age. Okay, that keeps when you walk, then your heart pumps, right? And your lungs also inhale and exhale. So what happens in that process? You're exercising your heart, you're exercising your lungs. So even if there is any respiratory illness, or even if you have any cardiac illness, your pumping systems will not get affected. And it's very important to keep your lifestyle well.
Thank you, Dushman. There's a query regarding the commencement of the online session for the fresh batch of healthcare management.
Yes, the hospital management session with the University of Hyderabad, the commencement will be in July. The session commencement will be in July, but the admission cycle will end by end of this April. So, and similarly for the healthcare management, these are ongoing admissions. So we are taking the active admissions now, and these sessions will also start in May. The healthcare management sessions will start in May.
Thanks. I've put those inputs in the chat box also for everyone's benefit. In fact, for downloading the brochure and filling up the form, you can please reach out to Mr. Dheeraj at the by number. He'll help you out in taking the admission.
Yes. So Urvi has asked what would be the salary. Urvi, the salary depends on the stage of your career. But if you're fresher and entering into this industry, based on the company, that if you're starting in a medical device company, then the start salaries may go up to 40,000. So starting in a hospital industry, they may start with 25 to 30,000. And if you're starting with a clinical research industry, if you're if a pharmacy background, and if you're starting a clinical research or pharmaceutical industry, again, it ranges from 30 to 40,000. So it all depends on where you start. Are you starting as someone who has got no experience or someone who has got a little experience?
Thanks, Dr. Srinivas.
Yeah.
So someone has asked about the curriculum and about data analytics, machine learning, and other modules.
Yes.
If any of these courses are also available.
Yes, Bharadwaj, the digital health touch upon these topics of AI, data science. Just to give you an insight what it is, you see there's a lot of patient data that is being stored either as discharge summaries or as OPD slips. A lot of digital data is getting into the hospital servers. So what does this mean? So a lot of data is getting and stored. When you store a data, this data can be stored on servers, right? If the server is within your hospital, then you call as data server room or something. If the server is not visible to you, and if it's stored somewhere, then it's called cloud. So cloud doesn't mean that we are putting it on the sky, right? So we are putting on a cloud. So when this data goes and sits in the cloud, a lot of data getting onto the cloud, what happens then? You need to do data mining. What is mining? When you're mining coal, you're removing coal from the mine, right? When you're mining gold, you're removing gold. What is data mining? That means all the data that you're putting onto the cloud is also mined in a proper structure. That is data mining. Then how do you put it in a proper structure? You need to have intelligence. If you're a doctor, then someone comes with abdominal pain and fever, then you will diagnose it as possibly appendicitis or a renal stone. You will ask 10 more leading questions, 20 more leading questions, and derive a diagnosis. How does a computer does that? That's natural intelligence of doctor. If a computer is data mining and machine learning, if the machine is learning and giving intelligence, that is called machine learning and artificial intelligence. It's as simple as that. These are very buzzwords, but very, very simple things. IT industry is known for creating buzzwords like cloud, machine learning, artificial intelligence. But if you bisect those words, they are very simple things. Yeah. But we have a wonderful course and we will teach you like a spoon feeding. Okay.
Thanks, Dr. Srinivas. So I guess we're out of time now. And
Yes.
I would request.
Good. I think
yeah.
we have exceeded our time by about 4 or 5 minutes. Thanks. Bharadwaj, I don't know which background you come from. Hopefully you're from an engineering background, but there's a lot of scope for engineers in the healthcare industry. Particularly with technology adoption being increasing now. Good. And if you are not on professional connecting platforms like LinkedIn, please go create your profile on LinkedIn. A lot of learning happens there. If you're spending a lot of time on social media, it's worth spending on platforms like LinkedIn, where you get a chance to connect with leaders and learn a lot. Okay, so this is my small piece of advice to all the students out there. And please don't waste too much of time on social media. Be fit. Don't be sedentary. Ensure that you're waking up early and sleeping early and waking up early. So these are small pieces of advice, and looking forward to see you as our students and part of Apollo MedSkills family. Thank you everyone for joining. Thanks a lot.
Thank you, Dr. Srinivas. If we had one more query, if you permit, I can just quickly read out. So
Yes.
there's a query related to someone who has an experience of 8 years in corporate hospitals, and the person wants to know what extra mileage he can get.
Definitely, Sahu, what happens is if you're getting a UGC accredited certificate, how you communicate it to your HR and during your appraisal cycles, maybe in the next appraisal cycle, it will definitely give you an extra advantage. And we will see that we will also support you with some letters of this thing. And if you perform well, then there are gradings in our course also. Definitely an added education will help you in stepping up in your career. Sometimes you may change your mind and change the industry, and that may be a turning point. The way for me, I did my, apart from medicine, I also did an MBA, and I'm in an alternate career now. Do I still practice medicine?
Right. So thanks, Dr. Srinivas. Thanks a lot for taking out time, and thanks to all the participants who took out time on a Saturday evening to attend this webinar. We've already mentioned the contact details, the toll-free number, the email ID, and the mobile number. Please feel free to reach out to us at any point of time. If you have any query, you can just type in your query, send a mail, send a WhatsApp, give us a call, whatever is convenient. We'll feel very glad to answer those queries. Thanks a lot once again.
Thank you. Bye-bye.